Welcome to Dr. Nasar Shahid's forum for how to prevent chronic pain, how to prevent chronic diseases, and how to achieve well-being. We are right now in the series of neck pain, and we have gone through different dimensions where we are working, and simultaneously if we work on all these dimensions, we have a better result. After diagnosing properly, confirming the diagnosis through studies, using the non-pharmacological treatment and using medication to break the pain cycle, now it comes that still the person is in pain, and because the inflammation is very intense, it has become overwhelming. So now we have to break the pain cycle not just by oral medication but through injections. Out of all the injections which we prescribe for cervical spine, for neck pain, the trigger point injections are very simple injections. What are trigger points? Now ideally trigger points are if you press on that point in the muscle. These are knots in the muscle. If you press on it, you feel the referred pain goings where you normally feel the pain. Most of the time people confuse tender point with trigger point, but the real trigger points are those which if you press on it, suddenly you feel the pain going down to the head, going over the shoulder, back of the upper back, and going into the arm. Anyhow, the trigger points are knots in the muscles. These muscles are superficial, and you can put a little lidocaine. Some people even say even if you put a dry needle in there, that can release the trigger. There are many reasons why it helps. It's not a scholarly vlog, so I will just say the trigger points relaxes the muscles because of the lidocaine. No steroids should be used in it. Why? Because the steroids are not good for our body as a whole, because nowadays we see that people go to a doctor, they give trigger points and they put steroids in there. Naturally, because of steroids you might feel a little better, but no problem has been resolved because of those steroids. Now you have a cumulative side effects of steroids, because then you go to the orthopedist who put some steroids in your knee, and then you go to a pain doctor, he puts steroids in your epidural space. So the cumulative steroids can cause more problems, which we will discuss in certain other vlogs. So the simplest injections, trigger point injections. Most of the time I do 3 series of trigger points. The reason 3 is because I want to make sure if by doing simple things, your pain cycle is effectively broken for a few hours to few days, and your body healing system has worked during this time. If that is not the case, I would like to do a transforaminal epidural injections. Now remember, the epidural injections are basically in the neck 2 types. One is transforaminal on the side, and the other is from the back, which we call translaminar. So either you do transforaminal or translaminar. I prefer to do transforaminal, but the transforaminal has many risks, and I will mention those risks when I'm talking about the risks of epidural injection. Here I'm just mentioning, and the way I prevent those side effects are very interesting, because everybody has their own learning curve when they start injection. I've been doing these injections for the last 25 years, so naturally I have my own methods of doing it by using very tiny needle, and the person is on the side rather than person is lying on his back. What I found is that if the problem is because of the nerve root and the problem is because of the disc, transforaminal injections at appropriate level is more effective than translaminar injection. If the person's arm pain is better with transforaminal injection, but the neck pain is still persisting, now I go to the facet joints. For the patients, everything is the same. He is lying or she is lying on the side. I look under fluoroscope, the special X-ray, and find the outline of the joint, and then put little medication in the joint, and I found it very useful. Once the pain cycle is broken, again the person resumes those exercises to strengthen the muscles, to stretch the contracted muscles and to improve the range of motion, and that's good enough to get out of this chronicity or acuteness of neck pain.